So we are on. When we talk about paranasal sinuses, para means around, nasal means the nasal cavity. So these are, I'll describe what they are, but they're all located in cranial and facial bones in this area right here, which I'm sure most of you probably already know that. So let me pull up my first whiteboard. We'll just get to business. Paranasal sinuses. These are basically air pockets or air cavities within bones. They're not super large. They are lined with mucus. Or so you can call them mucous membranes. It's actually the membranes that secrete the mucus fluid, and they drain into the nasal cavity. These are very small or even completely absent at birth. So they typically develop or grow after we are born. They grow typically during the first eruption of teeth and also onset of puberty as well. These are the bones, I'm just going to give you a laundry list of the specific bones that contain these paranasal sinuses. The frontal bone, which, just to remind you, that's the forehead and it goes up past the hairline. The ethmoid, that's that honeycomb-shaped weird bone right in the center of the skull, sort of behind the nasal opening. The sphenoid, which is that butterfly-shaped or bat wing-shaped bone, that's the keystone to the skull. And the maxilla. Those are the four main bones that contain the paranasal sinuses. The major function of these sinuses is, first, they all allow for growth of the skull post-birth, so for the skull to get larger and bigger without adding a whole lot of bone density or weight. So one thing that they do is they actually lighten the weight of the skull, which is good. It's not so much dense mass. They also increase the surface area of mucous membranes. I'm just going to write increase SA for surface area. And they allow for sound resonance. So when we speak, that sound is generated by our vocal cords down in our larynx. But you know that if you plug your ears, you can still hear yourself. I'm putting air quotes up right now, inside of your head. That's sound resonating mostly through your sinuses that you can hear. I'm just going to tell you what. That's SINU. I'm writing sinusitis. Sinusitis is just an inflammation of the mucous membranes found in these paranasal sinuses. And it's typically caused either from infection or allergies. Anything that ends in itis just means inflammation of, and this would be the sinuses, inflammation of the sinuses, usually caused from allergic reactions, infection, deviated septum, damage to that septum. All right, new topic. So I'm going to call up a new page here. And this, I think, I was just looking at your textbook. You'll find this topic at the end of chapter 7. I'm going to hit it now because we're talking about the skull. I'm wrapping up the skull. Fontanelles. It's literally dense connective tissue. But really what they are unfused cranial bones at birth. So you and I call them infants' soft spots on their head. So a fontanelle, that's what it is. It's a soft spot. And now you know what it is. It's unfused cranial bones. And this predominantly allows for growth after birth. Both bone growth and soft tissue growth underneath, like central nervous system. After birth, at some point, and it depends on what fontanelle we're specifically speaking of, the bones do fully fuse to form sutures. So a fontanelle is an unfused cranial bones, and they eventually fuse to form sutures. Remember, sutures are immovable joints with dense fibrous connective tissue, and the fibers are so short that the bones are basically interlocked. I'm just going to list the specific fontanelles and describe them to you. Don't know if I have time to write every word out, but I do want you to know I'm going to write F-O-N-T just for short for fontanelle. The anterior fontanelle. This is the largest. I'm going to tell you their location and when they typically fuse after birth, okay? The location is between the two parietal bones on the top of the head, the left and right parietals. So that space, that soft spot is between those two parietals at the frontal bone. So if you were to look at the top of an infant's head, there's the back of the head. This is moving toward the front right here, the forehead. So this would be anterior, posterior. We're talking about there's a space between these two parietals up here where they meet the frontal. So that anterior fontanelle is right about there. It's the largest. It actually ends up being a little bit diamond shaped. First, it's sort of diamond shaped like this. It closes at about 18 to 24 months. So I'm just going to write about 18. I'm just writing down when they close, typically when they close. Next is the posterior fontanelle. This is also has to do with both left and right parietal bone on the top of the head, but back at the occipital bone. So the occipital you would barely see from this view, which would be here. There's a posterior fontanelle back here. This one's not as large as the anterior fontanelle, and it closes much sooner, about 2 months after birth. Let me get my black pen back. Next on the list, it's a fancy name, but it describes exactly where it is. It's called the anterolateral fontanelle. Antero means toward the front, anterior, lateral means on the side. So this one is between the frontal bone, the parietal, and the sphenoid. So it's down on the lateral side of the head, frontal, parietal, and sphenoid. And there's an anterolateral on both right and left sides at birth. This has a you can see specific pictures at the end of chapter 7 in your book. It has a very irregular shape at birth, and it usually closes at about 3 months. after birth. And finally, the posterolateral, this is the last one. Also on just toward the back of the side of the head. That's what that word means. So we're still talking about the parietals laterally on each side at the parietals, the occipital and the temporals. So this one, the anterolateral, would be here. The posterolateral would be back here on the sides of the head. It also has this kind of funky irregular shape, and it begins closing about 1 to 2 months after birth, usually completely fuses at about 12 months. So begins 1 to 2 months with closure, and then fully closed at 12 months. All right. We're almost done, ready to move on to the vertebral column. So we are finished with the skull now officially. I am going to say just a few words about the hyoid bone, and I don't want to waste a whiteboard. So over here, I'm just going to write hyoid bone. This is a horseshoe-shaped bone, bigger than a 25-cent piece, bigger than a quarter, not much, that sits in our neck region above the larynx, where the Adam's apple is in our neck. If you were to look down a bird's eye view, like I did over here on the skull, at the hyoid bone, that's where it gets its horseshoe shape. It kind of looks like this. And it's open in the back. It's closed in the front, and there are little horns on it. It's the only bone in the human body that is completely unarticulated from another bone. So we call this a floating bone. It just sits in connective tissue in the neck. So just remember, no articulation with any other bone with the hyoid. It's embedded in ligaments and muscles. Basically, its function is it's an attachment site for tongue and neck muscles. It really does help us manipulate the tongue to articulate speech. And just so you know, these two little horns, there's evolutionary significance to that, but those are attachment points for ligaments and muscles. Okay, now I'm officially moving on to the vertebral column. I really want to get through the axial skeleton today. When we say vertebral column, most people just say spine. We're talking about all 24 individual vertebrae plus the sacrum and the coccyx. So in the vertebral column, there are 26 bones total, 24 individual vertebrae. All right? Because this number includes the sacrum and coccyx. There are 3 major sections and types of vertebrae. Most of you have probably heard these designations before. If you haven't, well, then you're going to learn it now. There are cervical vertebrae. That means in the neck. There are thoracic vertebrae in the thoracic cavity or chest. And there are lumbar vertebrae in the lower back or lumbar region. So they get their name based on location, obviously. In the human body, there are 7 total cervicals, 12 total thoracic, and 5 total lumbar vertebrae. The only vertebrae that articulate with our ribs are the thoracics. And it's easy to remember how many pairs of ribs we have. There are 12. So that just gives you an idea of the initial setup without me drawing some really complicated, fancy drawing, which would take me a long time. The curvature of the spine or the vertebrae goes something like this. A normal curvature would go, there's a slight, I'm having trouble with my plastic pen here, so let me start over. I do want you to know a normal curvature and abnormal curvatures, which I'll list. We do this, and then the vertebrae does this, and then it comes down. So it's kind of a fancy, little bit of a fancy curve. We call it an S-shaped curve for obvious reasons. Whether or not we call the curve convex or concave, I'm not going to list those because different books call them different things depending on what side you look at. So if from the front, this would be anterior and this is posterior to the body. So from the front of the body, this would be convex. The cervicals, because we're looking at this side. But some books say the cervicals are concave because they're looking at them from the back of the neck. So I just wanted to mention those words to you, convex and concave. That's very confusing depending on which direction of the human body you're actually viewing the vertebral column from. So I'll leave my anterior and posterior signs up. Obviously the skull would be up here. The rib cage would be in this area, the chest, and we'd have the abdomen to the person, sacrum, coccyx come down where sort of the gluteus muscle of the buttocks is. So that gives you an idea of sort of how the vertebral column sits in the human body. Let's say a few things about intervertebral discs. I know that we identified them when we talked about connective tissue. They make up a significant, about 25% of the height of the vertebral column. So they're not insignificant in their height value. The outer tissue is fibrocartilage. So I'm just going to write outer is fibrocartilage. The inside, they're kind of like jelly donuts because fibrocartilage is a little bit tougher. The inner portion, which would be the jelly portion, is a soft, highly elastic portion. Sorry, that's supposed to read elastic. The outer portion, the fibrocartilage, tougher fibrous thing is called the annulus, A-N-N-U-L-U-S. The inner portion, the jelly portion of that donut is called the pulpopus. So P-U-L, I'll try to spell this clearly with this pen, it's not easy, O-S-U-S. All right, so if you were to look at it for intervertebral disc, it has this circular pulposus is in the center. Evolutionarily, I'm not going to test you on this, just so you know, that's the remnants of a notochord, the inside of this disc. But clinically, there's significance to that. So there is technically a thin plate of hyaline cartilage around the outside at the top and the bottom for articulation, but I'm not going to draw that right now. I want you to know the basics of this. These discs are avascular. That means there's no direct blood supply. Okay? They receive nutrition from vessels surrounding the vertebral body of the vertebrae itself. When an individual, when we slip a disc or something, so from a side view, if this is bone of a vertebrae, let's just say, and this is a disc, and here's another vertebrae, creating that pad between them. Slip disc usually means a protrusion of that annulus this way. sort of sticking outward. So think of that jelly donut getting squished. It pinches nerves, causes pain, can be a real problem. Back surgeons, orthopedic surgeons, or neurosurgeons typically go in there and slice this bit off to relieve that impingement. A real problem occurs is if this inner portion, the pulposus, actually leaks out. So if this inside jelly part tends to leak out, then it becomes a real problem, and disc removal and fusion is typically the typical treatment for that. All right, let's look at the bone part of it now, the vertebrae. So I'm going to a new page. I'm going to write anatomy of vertebrae. I'm going to write vertebra. That singular is without the E. If I add the E onto that word, it means more than one. I'm just going to list some of the typical parts, and then I'll draw a picture. There's the vertebral body, vertebral foramen, vertebral arch, I'm not going to go have you learn all of the notches. That gets a little crazy. There is a spinous process. And transverse processes. There's more than one. All right. Now I'm going to give you, this is just a generic vertebrae. It's not really drawing any specific meaning. Cervicals look very different than thoracics, look significantly different than lumbars. This is just a sort of a textbook generic vertebrae. I highly recommend that you read your book. I'll be quick with this drawing. So that's a bird's eye view, looking down, not from a side view, a lateral view, but a bird's eye view, say from the top, a superior view of maybe a typical thoracic vertebrae. Nevertheless, the vertebral body is this solid portion right here. This is solid bone. And that would be, going back to my previous picture, that would be this part right here that the disc, intervertebral disc, is between. So I'm coloring in the vertebral body portion. What you see sticking out back here is that spinous process, which from a bird's eye view is here. So that's the one. The spinous process is the one that sticks off the protruding backwards in a posterior direction that we can see in our backs, the midline of our back. Those bumps are really just the spinous process ends protruding on the skin of our back. The transverse processes stick off left and right. And they're typically, I exaggerated them a little bit in my drawing. They typically aren't that large. The vertebral foramen means hole, is this big hole that runs through the center of the vertebrae for the spinal cord. And this term, vertebral arch, just refers to this part of solid bone. I'll draw it in yellow just because the drawing's getting messy. This part of solid bone around that vertebral foramen, that's the vertebral arch that the spinous processes and transverse processes sort of emanate off of. That's the basic anatomy of a typical vertebrae. Like I said, you don't have to learn all of the different notches and spaces that are created by the interlocking vertebrae. We just don't have time for that in this class. If you see or read the word facet, that's important to know what that means. A facet is an articular surface. We typically find facets, that's F-A-C-E-T. We typically find facets on vertebrae and ribs. And that's where vertebrae articulate with other vertebrae, as well as where the thoracic vertebrae articulate with the ribs themselves. So the word facet just refers to an area, a small area on that bone that actually articulates with another bone. Just to remind you, as we age, the vertebral column, these bones in particular, the vertebrae, are specifically vulnerable to reduction in bone mass and density, also reduced collagen due to changing hormone profiles in the body. All right, let's say something about the thoracic cage. That just means, think rib cage, okay? There are 12 pairs of ribs. I'm not going to get all hung up on ribs, okay? These 12 ribs articulate with the 12 thoracic vertebrae. So we've got 12 pairs. You know what a pair means? One on the left, one on the right. So there are 24 total ribs in the human body. Keep that in mind. There is a sacrum below L5, that would be lumbar vertebrae number 5. So we've got 24 vertebrae, we've got 7 cervicals, 12 thoracics, 5 lumbars, and right at the base of that 5th lumbar vertebrae, there is a sacrum that is sort of heart-shaped or triangular-shaped bone. It kind of looks like this. I'm going to run out of space here. That's the sacrum, its shape. Evolutionarily, this is 5 fused vertebrae. And you can actually, if you hold a sacrum in your hand, you can actually make out, there aren't lines, there are not epiphyseal lines, they're fully fused, but you can sort of imagine that there are 5 fused vertebrae when you hold one of those bones. The full fusion comes after birth, believe it or not, at like age, so I'm going to write fully fused, typically late teens, at the end of puberty, 16 to 18 years old. The coccyx, which is the tailbone, that's 3 fused vertebrae. That's what you and I call the tailbone. Sometimes it's 4 fused vertebrae. So let's correct that. I'm going to write 3 to 4, depending on what book you read. And those fully fuse even later in life. Fully fuse at early 20s. Can be as late as late 20s. So I'm just going to write 20 to 30 years old. A little bit of clinical speak here while we're talking about ribs as well. Rib fractures. I wrote this down in my notes because this is somewhat, we can put things into context. The most common rib fractures occur in the middle section. For different reasons. They're longer. They also protrude from the thoracic cavity more, so they're more subject to damage. We used to immobilize people with a broken rib. We don't do that anymore because that presents respiratory problems. Spina bifida is a congenital disease. It's a congenital defect of the vertebral column. So I do want you to know what this disease is. Typically L5 and S1. So right at the base of the vertebrae and right at the top of the sacrum, that area does not normally develop in infants that are born with spina bifida. And the fusion of the midline of the vertebrae doesn't fuse correctly. So a lumbar vertebrae has a very huge, dense vertebral body like this, a very, very small vertebral foramen because the spinal cord is so narrow down there. The foramen, this is a normal lumbar vertebrae. It's big, heavy, and dense because it has to bear a lot of weight. Well, when we are developing in utero as embryos, there's a fusion of this vertebral arch, of this bone to bone like this before we're born. In spina bifida children, that fusion doesn't fully happen, and there's an opening or a gap left along the midline of the back, typically in the lower back area at L5, sort of S1, L5. Going back to my black pen. This can be associated, children who are afflicted with this can be associated with levels of vitamin B or folic acid during pregnancy of the mother. There's different forms or different severities of this disease, of this fusion disease. Spina bifida occulta, that's OCC. Let me write that out in quotes. This is, sorry, there's an L in there. This is the less severe of the two forms. In the occulta form, the fusion space, the lack of fusion space is fairly minor and it's less severe. The cystica virgin is very severe. The membranes protrude through the spine, so we can get soft tissue in a cystica. Let me see if I can do a little erasure here. The soft tissue of the inside of the bone and the disc can actually protrude out. And that's very severe in the cystica version. And we get a sac with a spinal membrane on the back of the baby, the born child. Nerve roots can exit the body. It becomes a real problem. And this may interfere with neural control of the urinary system, of the bowels. Obviously, surgical intervention is the best treatment for that. All right, guys, you lucked out today. Nice short lecture. I have finished my lecture with the axial skeleton. So I'm going to cut off my recording. I'll say a few words after that.